In this video, I will go over 6 tips to improve your history-taking skills during your women's health rotation. After I graduated from a family nurse practitioner program, I was offered multiple jobs but opted to work in women's health field to see if I liked the specialty. I ended up liking it and have been working in the women's health for about 9 years. But I remember struggling initially with getting all the information from patients because women's health is a very specialized field and I didn't learn enough during the FNP program. Taking a detailed menstrual history is so important for women's health care because it gives so many insights of what's going on with the patient's body. Of course, whether we need information on menstruation depends on what the purpose of the visit is. But if patients are there for a woman exam, menstrual concern, or birth control counseling, you'll definitely need to have a thorough history regarding the menstruation. I precept family nurse practitioner students and share my tips on good history taken with them during their rotation with me. But I thought that I should make a video about this topic so other nurse practitioner students can also learn about this. I hope this video will be helpful for nursing students, nurses, nurse practitioner students, and new grad nurse practitioners to improve their history-taking skills, especially in the women's health field. Hi, I'm Miki Miura. I'm a family nurse practitioner based in Hawaii. I am the founder of the JNP project, which is a nursing education project in the US and Japan. In this channel, I upload videos about nurse practitioners and other advanced practice registered nurses and provide helpful tips for nursing and nurse practitioner students. So make sure to subscribe to my channel. All right. Let's get into today's topic. First tip is to ask about the age of menarche. The first thing to ask patients about their menstruation is the age of menarche. Menarche, which is the first occurrence of menstruation. Remember that the normal age of menarche is 12 to 13 years old. Menarche is considered early if first menstruation occurs before or at age 10. And the menarche is considered late if it occurs at or later than 15 years of age. Early menarche is associated with an increased risk for multiple diseases such as certain cardiovascular disease and breast cancer. Late menarche may suggest primary amenorrhea, and you may need to rule out congenital conditions and chromosome anomalies. Second tip is to ask about regularities of menses. Next, you want to ask about regularities of your patient's menses. If it is irregular, then ask about when it started to become irregular, or if it has been irregular since menarche. You also want to ask what her menstrual cycle is. Some patients may say they have irregular periods, but if you ask more about that, they may say their menses are always occurred every 30 days or so. Some patients misunderstand that the menses don't come exactly on the same day of each month, and they think that they have irregular periods, but that is actually not true. So you need to ask about actual menstrual cycle length. Remember, menstrual cycles ranging from 21 to 35 days is considered normal. Some patients may say their periods are so irregular that they cannot really describe their menstrual cycle is. If that's the case, you can ask them to describe the range of their menstrual cycle. For example, you may ask, can you describe the range of your menstrual cycles? Do you have a period every 1 to 6 months? What's the longest length of time you didn't have a period? The third tip is to ask about the length of each period. Next, you want to ask about the length of each period. Again, patient may need to give us range of duration of menstruation. You should also ask out of those days, how many days they have heavy flow. The fourth tip is ask about the amount of bleeding. Since you ask about the heaviness of their periods, you should ask more detailed questions about the amount of bleeding. I usually ask what they use for menstruation. Do they use pads, tampons, or menstrual cup? Or do they need to use both pad and tampon at the same time because they are so afraid of the leakage? If the patients say they use pads, maybe ask about do they use panty liners, regular pads, or max pads? Then I ask about how often they change their pads or tampons or empty out their menstrual cup. You can ask how many times patients change them or how often. For example, in the form of every so and so hours. I also ask how much their menstrual hygiene products are filled when they change them. Some women like to change their products often, like every time they use restroom for hygiene purpose. I usually frame the question like, how filled are your pads, tampons, menstrual cups when you change them? Are they fully soaked or just half soaked? Or do you change them regularly regardless? You should also ask if they have blood clots and the size of those blood clots. The fifth tip is to ask about pain. The next thing you should ask your patient is whether they get menstrual cramps or pains or not. If they do, make sure to ask how painful it is and whether they need to use pain medication to control the pain or they can manage the pain without medication. While the pain scale is helpful at times, it is very subjective and people rate their pain differently. Some may say their pain is 9 on a scale of 0 to 10, but still can manage without pain medication, while others may say their pain is about 2, but they need to take Tylenol every 4 hours on the dot. The final tip is to ask about effect on patient's life. Lastly, you want to make sure to assess how bleeding and menstrual pain affects patient's life. Do they have to abstain from school or work because the pain is so severe? Are they afraid of leakage? Some women are used to bear with heavy bleeding and pain, and they may think that it is normal to suffer from those problems. As a healthcare provider, it is important to inform patients that there are some treatment options that may improve their conditions, therefore improve their quality of life. I hope this video was helpful to you. If you like this video, please like and write a comment in the comment section on what kinds of videos you would like me to create in the future. I also upload a new video every Sunday, so don't forget to subscribe to my channel. See you in the next video.